Thanks, Terry, for that introduction and for giving this Victoria J. Mastrobuono Women's Health Award. And especially thank you for your dynamic and deeply committed leadership for women on the most important issues. Even more, thank you all to the leaders of now, organizing to build a better world. I first joined NOW when I was already part of the women's liberation movement in August of 1970, seeing the enormous outpouring of women during the women's strike. You know, the theme then was, don't iron while the strike is hot. Now was the leading force of the movement, and you're still the remarkable leaders we've been waiting for. You know that if we organize, we can change the world, and you have been changing the world for the better. I understand you're continuing and even deepening this at this convention as you're developing driven, coordinated issue campaigns for women's lives and women's future. In 1960, when I was in college, a classmate of mine was raped at knife point in off-campus housing in her bed. We went with her to student health, and she was told that student health didn't cover gynecological exams, and she was given a lecture on her promiscuity. We sat with her. They called it a sit-in. And because people organized, of course women can now be covered at student health. But we only say of course because people organized. And there's still such a fight around women's full health coverage. But we can change the world when we organize. In 1965, another friend was pregnant and was nearly suicidal, not prepared to raise a child. She asked for help to find someone to perform an abortion. I went to the medical arm of the civil rights movement that I had been involved with and found an extraordinary doctor, Dr. T.R.M. Howard. He performed the abortion and it was successful. A few months later, word had spread and someone else contacted me. They also had a successful procedure. Word spread again, and other women came. I realized there was a great need. We must keep women's health and abortion safe and legal. And women must have a say over whether and when they want a child, and if they want children. So I set up a counseling service, and for anonymity, we called it Jane. I recruited others to Jane, or the service as we called it, and over time, the women involved in Jane began to perform the abortions themselves. Between 1965, when I started Jane, and 1973, when Roe became the law, women involved in Jane performed over 11,000 abortions. These were remarkable women. Jody Parsons, Ruth Sergel, and many others, captured now on a film, a book, and a play about Jane. But abortion is still under threat. Nearly half of all pregnancies of American women are unintended, and about 4 in 10 of those are terminated in abortion. Nearly 1 in 3 women of childbearing age will have an abortion. The procedure is under threat, though. There are violent tactics by opponents to intimidate doctors and patients. There are bans on safe abortion methods that would protect women's health. There are restrictions on low-income women's access to abortion and other health care. There are dangerous laws that jeopardize young women's health and safety. There are so-called crisis pregnancy centers that intentionally mislead women, or personhood measures that would ban abortion, distortions of science that instill fear. Remember those statements saying there's legitimate and illegitimate rape. Refusal clauses that would deny women basic health services. And on all these issues, NOW is there for the fight, for women, for health, for choices, and for our lives, for all the women and men who've organized for a better life for women, for all the women and men who are organizing still that women may lead a life with dignity and equality, and for NOW, who helps lead the way. I thank you for this Victoria J. Mastrobuono Women's Health Award. Thank you for all you've done, and all you will do, and all we'll do together. It is time to organize, to join together, to set priorities and move to build our power, build a movement, improve women's lives, and change those relations of power in the country till women can have the life we choose on equal footing. Thank you, NOW, for making this possible. Thank you for recognizing Jane. And thank you for your continuing work for freedom, justice, and equality.